guys, so today we are demonstrating the AED. It is located in the cottage. This is a device that if somebody is down, as far as you don't know what has happened to them and you're going to check on them, even if you don't know CPR, you can start this device. So this device, if somebody's down on the ground, somebody's gonna run and grab this while somebody else is calling 911, and then when you get to the device, it just pops open, and then there's pads inside that,
if it would happen to be a man for some reason, there are usually scissors and a razor blade that usually if you have to shave chest hair, but you probably won't need that.
and there are pictures. They are pretty easy to use.
This shows you exactly where to place them.
So you will need skin contact, so you will have to either pull a shirt up, take a blouse off, something. At this point, we're not too concerned about that, but it does have to be skin contact. And so the pads will be placed on the person who's down. And then at that point, you're gonna turn on.
And if a person has a
the device.
pacemaker, you don't want to put it over their pacemaker. And you also want to make sure that they're not laying in water.
Adult pads.
It talks to you.
Unit okay. Stay calm. Check responsiveness. Call for help.
You've already
Stay calm.
kind of done
Check
through the calling for help.
responsiveness. Call for help.
At this point, you've checked them, they're not breathing, you don't feel a
Open airway.
pulse. You do want to gently tilt the head back just to
Check
make
breathing.
sure
Give
that
2 breaths.
there is not an
Attach
obstruction,
pads to patient's bare chest.
and it will talk you through putting the pads on. There is a mouthpiece that you can give 2 breaths, and at this point it's going to start recording if you have a shockable
Attach
rhythm.
defib pads to patient's bare chest.
So I don't know that if it will go through the system because it's not going to record that it's a bare chest, but we'll kind of play it out. So at this point, bare chest, the machine is going to tell you if it is a rhythm that is shockable. Not all, a flat line, meaning no heartbeat, is not a shockable rhythm. It will tell you to start chest compressions, and then you'll go through CPR. If it is a shockable rhythm, it's going to tell you that it is a shockable rhythm. And so it will talk you through, it is a shockable rhythm. You're going to step back. Nobody can be touching the patient. And then it will tell you to push for a shock. And then at that point you will push, it will administer a shock, and then you will proceed with CPR until it tells you to either not a rhythm or until paramedics arrive.
So when you're doing CPR or when you're checking to see if you need to do CPR, you always listen to see if they're breathing. You always check for their pulse. And one standard thing to remember is you never shock a pulse, because that means they've got electrical activity. So you never want to shock it unless that machine tells you.